Um, Very pleasant surprise, Mr. Aaiyappa. It's been 1.5 years since we met you, and I realized this morning it has been a fairly fantastic journey for you. So, you are visiting us again from Germany. Good to have you here. I'm Dr. Ravi. I'm the clinical director, as also the chief heart surgeon, Mysore Narayana Multispeciality Hospital. And with us, we have Dr. Rajendra, who is our senior interventional cardiologist, trained from UK, and he has been with us for almost 7, 8 years. I'm sure you remember he did the angiogram for you. So when you landed in Mysore, the first time you came here. Again, welcome and very nice to have you here.
So, Ravi, it's indeed a wonderful pleasure to see Mr. and Mrs. A. I remember you had come straight from overseas. Mr. A had been diagnosed with having had a heart attack. You'd had an angiogram, and you were in two minds as to what was the best approach to go through. Correct me if I'm wrong. You had been advised angioplasty, then there was talk about surgery, then again, so it was a lot of thing to take for a young person who not only to be diagnosed with a major heart problem, but also to be in a quandary as to what is the best treatment forward. So what we did was we did not have much information with regards to the CT and everything. So we simply repeated an angiogram. We sat together, the heart team, Dr. Ravi, myself, the patient, and his wife, and it was a very simple sort of process to come to a decision as to what was best for you. Not just what we think is best for you, but also what you felt was best for you. And I remember you had surgery. We will talk about the surgery. Dr. Ravi will give us more information. It was a fantastic surgery, and you breezed through the post-operative period. And we've just been talking, and it's been wonderful to listen to what all you've been through. So we'll listen from Mr. A himself. And before we go through to him, I would like to congratulate both. And there's a saying that I was just saying. There's a successful woman behind every successful man. Now there's a woman indeed beside a successfully operated man. So I think we'll have to change that a little bit. So we'll hear from Mr. A himself as to what all he's been doing since the operation. It's a major surgery, he's had bypass surgery, and it's wonderful to see him get through not only into the mainstream, not only being productive to himself and his family, but also to the community per se. So over to you, sir. Tell us what all has gone through since the surgery, because it has been a while since we've caught up.
Thank you for this. Initially, I was little hesitant. Even I can say like I was afraid also. Like because I do not know like post surgery, how will be my life? Whether I will be able to continue the same life like before, which I was doing. But after the surgery, like it was like a new life for me. Everything got changed, and um it's like I had so many problems before. Like after the surgery, like it's like for initially for some months it was difficult. I had some pain and difficulties, but later slowly I started walking, and later I increased my pace. I started running also. Like
So you're absolutely right. There's another saying, no pain, no gain. So just tell us what all have you done? You seem to have achieved a lot with regards to your own sort of getting back to normalcy, not just normalcy, also, training. And I gather you've run marathons, and that's an amazing thing to do.
after the surgery, within I think after 2 weeks, we again went back to Germany. And in Germany, normally they offer a rehab type of for all the patients. But because of the COVID situation, I could not enroll in that. I wanted to, but I could not enroll. What I did is like my with my wife, and she had a very good diet plan for me. And every morning I used to go out with her for a walk, maybe an hour. Initially, it was painful, but I did not give up. Like I continued. Even in the winters, even in during the snow, I went out.
When we initially heard that he had to get operated, we were devastated as a family because he has small kids and he's so young. We were really worried about it. Then once we got the reports in Germany, what did is I called Dr. Ravi through WhatsApp, and I asked him what should we do, because we were not very sure of getting operated in Germany, because he wanted to meet his parents here, and we have had a very bad experience also regarding surgery once with his friend in Germany. So we came to India. After we came to India, we met with the doctors here, and after we spoke to them, we were assured that it is all going to be okay, not to be worried. In fact, getting operated is not a bad thing. In fact, he's going to get a new life with that, and it proved to be right. And after the operation, for few days, he was very depressed, and he always had that thing like, I got operated at a young age. But after a few days, he made up his mind. He was determined, and initially he started walking. Later, after a few months, he started running a few kilometers, and now in 1 year's time he has completed 9 half marathons and 1 full marathon, and I'm really proud of him, and thank you, doctors.
Amazing.
Yeah.
That's wonderful to hear. It's not only heartwarming, it's very, very inspirational. There are so many negative thoughts that come through major surgery, but here you are, a living example of how you can turn things around and sort of make it to your benefit. Yes, it's a major surgery, it's life changing, but it's also life preserving, and it's changed your life for the better. And we want your story to be inspirational to hundreds and thousands of people who undergo surgery. We are seeing heart disease at a young age, and there are lots of reasons for that. So we will go across and ask Dr. Ravi two things. One is, what was it that was so special about your surgery? And number two, what are the other guidelines that post-operative procedures for post-operative patients should follow? So Dr. Ravi, Mr. A had a fantastic surgery, he's done really well. A lot of the credit goes to Mrs. A. Equally, the credit goes to the surgeon for mending it and doing a wonderful job. So what was it that was special about this particular surgery?
Indeed, Dr. Rajendra, it was an experience for him and for the family. I remember, I think we operated on him on the 30th of January, and the 31st of January was his birthday. And of course, his birthday is everything to his family. So we had to make sure that the next morning he would cut a cake in the ICU itself. And being young, it was our responsibility and commitment to the family and Mr. Aaiyappa himself that we would make sure that we would do an operation that lasts, and that lasts long. So he had multiple blocks, if you remember, and the idea was to put as many arterial grafts as possible. And so we took both the mammary arteries, bilateral mammary arteries, and we made a Y out of it and sequenced all his blocks with the 2 mammary arteries. And as you know, the results of this complete arterial revascularization, if you along with that maintain your lifestyle and continue to take medicines as advised, these grafts should last you a lifetime. And these are God-given things, the natural things that your body has, and we use the same conduits what God has given you to create new conduits for the blocked vessels in your heart. So that is the beauty of it, and we were able to do that. And of course, the same evening, I think you were out of ventilator. Next day morning, I remember you celebrating your birthday with all of us, with the cutting a cake, and it was indeed a moment to relish, not just for you but even for the team, because it's an end-lifting experience, a morale boosting experience, not just for the family and the patient but for the entire team. So that was an amazing experience.
Indeed, Dr. Ravi. It was definitely a day worth remembering. It was not just a birthday, it was a rebirth day, if I were to put it that way. So, again, this emphasizes the importance of early detection, a team effort or a team approach with regards to the best treatment for the patient so that the outcome can be the best that can be achieved. And clearly, you guys are living examples of how a patient should adapt and modify their lifestyles so that the chances of this happening again is minimized. Clearly, again, a living example that a person can lead a normal or indeed a supernormal life post major open heart surgery also. Cardiovascular disease, heart attacks are the major killers worldwide. There is no comparison to how much death cardiovascular diseases causes compared to everything else put together. So it's the leading disease of death and disease morbidity. A lot of hospitalizations and healthcare costs accrue because of cardiovascular disease. Prevention is always better than cure. So a healthy lifestyle, stopping smoking, regular checkups, regular walking. Healthy lifestyle includes exercise, physical and mental, and also eating normal or avoiding junk food. And regular exercises, meditation, yoga, it all goes a long way in sort of keeping us healthy and preventing disease so that we all lead a normal, healthy life.
So, Mr. and Mrs. Aaiyappa, it was indeed a pleasure chatting up with you. Also, Dr. Rajendra, it was indeed, the thoughts that you shared with us are really meaningful for people at large. Generally, people feel that, to get the best possible things, you have to either travel to a big city or the Western world, maybe the US, maybe the some part of Europe, to get the best things done medically. So, but here you are, who had a wonderful experience, both the surgical, medical wise, and also the facility as a whole at this hospital. What have you got to share about that?
Actually, I was very well taken care, that I felt like it was like a home. Like the staff, the doctor, like was always available for me for all my questions, post or pre-surgery. And this also helped me a lot for my recovery also, because mentally I was strong, because it was always a positive approach. So, and also after the surgery also, like for 3 or 4 days when I was in ICU, and it was the sisters, they all took extra, like I don't know, like I felt like I totally forgot the pain what I had. So it was like so fast that after a week, not even a week, I think 4 days, I was discharged and I was back to my home. And after that, after a month, I just came for a checkup. It's not like regularly I must come here. So I never thought all this will happen before. Like I thought it's so critical. I had to be in hospital for more days or something like that, and whether I would be able to recover fast. But that was not. Uh,
This is again, sir, we see this is a fear of the unknown. Surgery, it
yes.
doesn't have to sort of mean that it's a doom. And very well said, Mr. A, that you can have a major surgery, you can get back to normal life, and you can be an example to others.
And even my wife, who was waiting for me outside, she also had a like to say maybe, because she was.
I would like to tell that though we think that we everybody who is super rich, and we keep hearing that all the celebrities they travel abroad and get treated, we think we don't have enough facilities in India, but what I would tell is the doctors in India, they are more experienced and they take chances, not like what we have seen and experienced ourselves in Germany. The doctors there, they are really not very sure about, like they tell all the outcomes. They tell this happens if you go this way, this might happen. If you go this way, this might happen, but the risk is left to us. But the doctors here, they assure us, no, if you take this way, it's going to be all right. So that assurance is not there abroad, is what I would like to say. That is one thing that made us come here.